VMO TKE. The VMO refers to vastus medialis oblique. It's the internal portion of your quadricep. When you contract your quad, this is your VMO. TKE refers to a terminal knee extension, meaning we're going to take a very short range of motion and we're going to terminally extend the knee, meaning you can't extend the knee any further. The range of motion with this exercise is going to be about that distance, 4 or 5 inches. The first thing you need to worry about with this exercise is placement of the platform. Now, these four-way hip machines have a tendency to be a lot different in many places you go. They look different, but they're the same. The one thing that you really need to be concerned about is the location of your hip, your ball and socket of your hip. When you stand up, and you can feel where the ball of your hip goes, where it feels. You can feel it coming in and out when you move side to side. If you place your hip onto this button, that's how you need to adjust the platform. So the ball of your hip goes onto this button. Every four-way hip has this button. So this is the most important aspect of adjusting this machine. Place the prescribed amount of weight on the stack. In this situation, we're going to go quite heavy. Young Billy is quite strong at 150. We're going to bring Billy in. We've already adjusted the platform for Billy, so his hip is nicely correlated to the ball. He's going to place his leg over the top and draw the weight back down. Both of his feet are going to sit parallel. His chest is going to be up. No rotation in his hip. His hips are going to be nice and strong. He's going to allow the weight to come forward, but not so that his heel comes up off the floor. The only amount of distance coming forward before the heel comes up. You can see as he comes further forward, the heel can come up. So we only want it to the point where the heel does not come up. That's as far forward as we're going to come. Then he's going to extend back and hold it for 1 second. Hold it for 1 second. You see the range of motion is very short, and the medial portion of the inside portion of his quadricep is doing the majority of the work. Perfect. So as he comes back, hold 1 Mississippi and then come forward. So you see the range of motion of this exercise is only about 4 or 5 inches. Very important exercise for reducing tendinitis in your knee. Basketball players have a tendency to have a much stronger lateral quadricep than medial quadricep. This exercise targets the medial portion of your quadricep and will help keep your patella in alignment. So if you have trouble with jumper's knee or tendinitis, whatever the expression is used, this exercise is very valuable for you. So you'll do the prescribed number of repetitions. No movement at the hip here. You wouldn't want to see you trying to turn sideways to get the weight back. So you watch Billy go through the range of motion. Very controlled at the core and the hip, very short range. This is a very important exercise. Then we're going to, after you've done the number of repetitions, you're going to go ahead and let the weight go. And then you simply would rotate to the other side and perform the same number of repetitions on the other leg. So go ahead and take it down. You see the feet parallel, nicely balanced over the top of his center of gravity. And then same thing, short range, squeeze and hold. Hips very stable, upper body very stable. 1 Mississippi and forward. Nice 4 or 5 inches of play. Perfect, Billy.